Hello everyone, welcome to sqadia.com, and now in our second section of the lecture topic Benign Lesions of the Cervix, we will talk about eversion and cervical tear. In this section we will talk about what's eversion, what are the different types of cervical tear and why it occurs and how it can be treated. Eversion is also known as ectopy. This is the normal cervix here. This is the cervical region. Cervix is the lower portion of the uterus and it opens into the vagina. This is the normal cervix, and this is the cervix with the ectopy or eversion. Cervical ectopy. Cervical ectopy is again replacement of the lining of the endocervix with the cells of the ectocervix, which are the columnar epithelial cells. This is the cervical tear. Here in this picture you can see this is the normal cervix, and cervical tear is the laceration of the cervix. Cervical tear are very common after the delivery, especially if it's the cervix is not fully dilated, or if the delivery is done with the help of instruments, or it's with evacuation. So all these things can lead to cervical tear, and it is a very painful condition, cervical tear. So this is the different types of laceration or tear of the cervix. Most common site of this cervical tear is on the lateral side, and it's usually at the 3 o'clock or 9 o'clock position. So laterally 3 and 9. So this is unilateral transverse laceration or tear of the cervix when only one side is involved. When both sides are tear is present, this is the bilateral transverse cervical tear. In this stellate is a star-shaped and with a radiating type of tear. Here you can see all these are star-shaped tear. So cervical tear is the laceration of the cervix, usually after delivery, more common in the first term pregnancy, when the cervix is not fully dilated, or when the delivery is with the help of instruments like evacuation and forceps delivery. It is mostly in the lateral 3 and 9 o'clock position. It may be unilateral or bilateral, or it's of stellate type, which is a star-shaped cervical tear. Thank you for watching sqadia.com.